Hello, I'm Dr. Ali. I'd like to welcome you back. We know that when you improve your health, you improve the quality of your life, and our goal for you is to bring you the knowledge and resources that you need to empower yourself, your family, and your community. If you're joining us for the first time, make sure that you subscribe so you can make informed changes to improve your mind and body. Today, we are going to be discussing new research. This is our research segment where we bring to you new knowledge that is being generated. The research that we will be discussing is related to hormonal imbalances and its relationship to heart disease. When we talk about menstrual cycle, we know that this is a process which is controlled by many different glands that produce many different hormones. We're talking about estrogen, we're talking about progesterone, we're talking about testosterone. But at the same time, we are also talking about thyroid gland because it has major implications for the hormones. And we're also talking about cortisol, which is released by the adrenal glands. The menstrual cycle length is generally considered to be around 28 days. However, it will vary from person to person and also from cycle to cycle. If a woman has cycles that are over 40 days or less than 21 days, then they are considered to be abnormal. So anytime somebody has very short cycles or very long cycles or has abnormalities of periods or what we call irregular periods, then that is an indication of underlying hormonal imbalance. That also means that they are having issues with the functioning of the glands, whether it be ovaries or thyroid or the adrenal glands. So the question is, why are these glands not functioning? So there are many reasons why these glands may actually not be functioning well. These reasons include high degree of stress, inflammation, presence of toxins in the system. We also see irregular periods in women who gain or lose excessive amount of weight. We also see this in women who are doing strenuous physical activity and have low BMIs. So now let's look at the study. The study was published in October of 2022. And the researchers were looking at the menstrual cycle abnormalities, whether it be irregular periods or very short periods or very long periods, which are considered to be abnormal. And they're looking to see if hormonal imbalances can independently predict the possibility of heart disease and stroke in women. So the study consisted of 8,630 nurses. These nurses were followed for a period of 24 years. And during this time, 1,816 of them developed heart attack and strokes. So let's look at what did they find. They found that women who had irregular cycles or no periods at ages 14 to 17, 18 to 22, or 29 to 46 years, or those who reported a cycle length of 40 days or more, were found to have higher chances of developing heart disease and stroke later in life. Now, this is very important because this means that if a woman is having irregular periods, she may be at higher risk of developing problems with her heart and possibility of developing stroke, which means that these women should be offered screening to be able to look for heart disease, and they should also be advised on how they could prevent heart disease and stroke. So the question then becomes, how do we reduce the risk of an irregular period, or how do we reduce our hormonal imbalance to prevent our risk for heart disease and stroke. So there are a number of strategies we can use to reduce our hormonal imbalance, one of them being reducing inflammation through anti-inflammatory diet as well as physical activity. We can practice stress reduction and relaxation techniques on a daily basis. We can cut back on prolonged or intense exercise routines. And we can also make sure that we are detoxifying every day through sweating, regular bowel movements, and hydration. We hope to bring you another research topic in the near future. Stay tuned.